Good day and welcome to Mental Health and You. I'm your host, Cynthia Timms. The big and beautiful Bronx. Let me say that again. Sometimes we tend to forget just how big and beautiful our borough is, our corner of the world is. The big and beautiful Bronx. It's the home of the Yankees. It's the home of some of the most beautiful greenery in all the city, including the city's biggest park, Pelham Bay Park, with all its diversity in people from all backgrounds and from all walks of life. Its beautiful food, its beautiful languages, the smell. It's the home of hip hop, the birthplace of hip hop. So, with all of that it has going for it, why, why, according to certain reports, it has been ranked for the past 10 years as the least healthy county in the state. 62 out of 62 counties, the Bronx has been ranked. And how can that be changed? And why is that? To help me sort all of this out, help us sort all of this out, is my guest, Maurice Hurd. He is the founder and CEO of Most Healthy Bronx. Maurice, I want to thank you to the show. Thank you for joining us on Mental Health and You. And what's up with that? First, we want to talk about your organization, which is so needed and so necessary. Most Healthy Bronx. Tell us a little bit about it and why was it necessary?
Yeah, thank you, and good afternoon, Cynthia. I just want to say thank you for inviting me to your show, and thank you for that wonderful introduction. You focused on the positive there, and that's something that I feel like we all need to do a better job at. The Bronx is, like you said, developed a reputation for having poor health outcomes, but there's so much beauty here that we
Yeah.
uh, should, capitalize on and try to push forward to change these narratives. Um, and so, speaking of these narratives, back in, at the height of the COVID-19 pandemic in New York, we were hearing all these reports about Bronx residents have, a higher likelihood of developing COVID-19 compared to, people from Manhattan or people from Queens or Brooklyn, Staten Island. And to me, that was just something that just didn't sit right with me.
Hmm.
And being somebody who has studied public health and biology in school, I understood that it wasn't something inherently wrong with Bronx residents, but it's the factors around Bronx residents. So that leads us to the founder of Most Healthy Bronx. Um, in that report that you eloquently brought up, it's the County Health Rankings and Roadmaps
Yeah.
report, which
Yes.
is an annual report issued by the University of Wisconsin Population Health Institute in conjunction with the Robert Wood Johnson Foundation. And
Right.
they have a ranking system, a model where they determine that I have the numbers here. Uh, 30% of a person's overall health is determined by their health behaviors. So, whether or not they exercise and diet correctly, whether or not they use different tobacco and alcohol products. 20% comes from their healthcare access and the quality of that healthcare. 40%, now this is the biggest contribution to that model is socioeconomic factors, and this has to do with people's, access to jobs, access to education, community
Hmm.
safety. A lot of these factors are what determines a lot of Bronx residents and people in general's poor health. And then there's another 10% that is focused on access to clean air and clean water quality. As you know, the Bronx has had high asthma rates compared to the rest
Yes.
of the country, and that's due to the proximity to highways, the different expressways where exhaust trucks emit their different gases and fumes into the air.
Maurice, you're asking, you said something there, but
Yeah.
surely the Bronx is not the only. I mean, that's awful. That's terrible. But surely the Bronx is not the only area, not the only neighborhood where the fumes from gas tanks and cars
Mhm.
are polluting the environment and making its people sick. So what is it so unique about the Bronx where it's
Yeah,
ranked too? There's cars coming everywhere. There's highways all through this state.
very, very, very good point.
The Bronx and its asthma rates that
Uh-huh.
is so much more elevated, it seems, than other places.
Yeah, so I don't
Curious about
necessarily have all the answers to that question,
Mhm.
but I can tell you that there's a thing called Superfund sites. Superfund is one word. And this is basically an area that's pretty much a landfill where sort of
Mm.
toxic waste is dumped, and things like this just sit there, as construction projects are being built in and around the city. I
Yeah,
believe in the 90s and in the early 2000s, the Bronx had the highest number of Superfund sites in New York
really.
City. Yeah, so granted, a lot of these Superfund sites have now since been um, closed down and sort of revitalized in a way. I don't know if you know, but in the area surrounding Co-op City in the Bronx,
Mm.
the Northeast Bronx, there was a big Superfund site. I don't have the name of it at this moment, but this was recently, cleaned up in the mid 2000s. So I think it's the remnants of these old Superfund sites that have and had contributed to the high asthma rates. But you're right, access to
That's
highways, we
interesting
see
that
those
you said
everywhere.
that. That's
Mhm.
interesting, Marie, that you said that because as you were saying that, I'm thinking of all of these, developments, whether it's housing or
Mhm.
parks or schools that's been built on the site
Yeah.
of old dumps, whether it's the Riverbank Park with its chimneys that's now a part of
Yeah.
the landscape, whether
Mhm.
it's Great Hills in what's that part in Staten Island where all the junk, all the remnants of 9/11 was dumped.
Mm. Yeah.
I'm thinking about Hunts in our area. I'm thinking about Hunts Point as
Mhm.
well as Co-op City area, as you pointed out. So you got all of these former wastelands now being redeveloped, but yet the chemical, the poison is still within the earth.
Yeah. Yeah.
So now, yes, you're building a nice home, you're building a school, you're building a park, but what's underneath that? And it's, I guess, now we're suffering for it. Why?
Absolutely.
Because in development, you really in the haste to develop. There's nothing wrong with developing, but what's being left behind and within the earth.
Exactly. And as you say, left behind. Sorry to cut you off, but as you say, left behind. It's almost like these developments are being built, but the people who live in these areas aren't getting a piece of the pie.
Thank you.
So we've seen it in Brooklyn. Everybody's talking about gentrification nowadays,
Mhm.
and the influx of people who are not originally from the neighborhood, who are of higher economic status. They move into the neighborhood to sort of boost the economic and social capital of the neighborhood.
Mhm.
And that sort of hasn't happened to the Bronx yet. There have been discussions about it with, I believe, the area near Hunts Point. The name that they gave to it is the Piano District. See, they're trying to change the marketing of how they name these neighborhoods. So like
Yes,
see
yes.
in Manhattan,
Sort of
Soho,
like Mount
south of East
Haven.
of Houston. Yes,
Yeah.
exactly. Yeah, it's like Bronx residents aren't being included in that share. You know, developments are being built. The rents are astronomical. And I have a statistic here that says 32% of Bronx residents spend at least half of their income on rent. So if people don't have money to afford these rising rent costs, then inevitably then that's going to lead to people maybe losing their homes, their apartments, people, you know, the rate of homelessness increasing. And then that just furthers the burden of, of these social programs and things of that nature. It's just a never ending cycle.
So be that as it may, in the midst of all of that, what's the mission and the value and the vision of Most Healthy Bronx? To change the narrative, to change the direction, to give some hope to those of us who are looking for it.
Yeah. So we are huge on advocacy and education. We believe there's not going to be a one size fits all approach to remedying this issue. We want to sort of be able to educate people of the Bronx so that they themselves can take whatever necessary steps that they can, as much as they can, to improve their individual health. And then we want to work with policymakers to sort of create macro solutions. So like I said, provide more job opportunities in the Bronx, improve the quality of the education, improve the quality of the healthcare. But first we want to establish what the problem is, develop a sense of urgency. And in advocacy, that's sort of what you have to do. You have to make the situation plain to individuals who may not understand that there is a problem. So, for example, I'll give you a little example of that. Back in middle school, for example, a common breakfast meal for me and my friends was a bacon, egg, and cheese and a however many liter dollar like Arizona iced tea bottle can. And I mean, it tastes great, but that's not nutritious, especially for somebody who's developing and trying to grow into a healthy adult. Many people, this isn't really any fault of their own, but people just don't understand what it means to eat nutritiously. People don't understand what it means to exercise and how to exercise, proper ways of exercising. So we want to first empower individuals to understand how to take better care of themselves as people. And then we want to actually hold, these people in government, these policymakers, we want to hold them accountable as well to ensure that they're keeping their promise, because, as constituents, they sort of work for us, and we have to actually ensure that they're doing what they campaigned to do, what they said that they would do. Like, you don't just get to have our votes and, not actually follow through on that. So we want to keep the government accountable as well.
And how do you do that? I mean, the government is one thing, Maurice, it's been in my experience, but it's the grassroots part.
Yeah.
The partnership with other maybe community organizations who are dedicated to, helping its citizens, to the cause that you're talking about. I mean, maybe healthy eating groups, exercise groups. Because we're talking about health. It's the most healthy Bronx. So I'm thinking your mental health, your physical health, your financial health, So what is Most Healthy Bronx? How are you trying to partner if with other
Mhm.
organizations if to make this a reality?
Yes, absolutely. And community partnerships are huge. There are tons of organizations already doing a lot of great work in our community.
Yeah.
First, I want to shout out Bronx Soul, which is
Yes.
a running group in the Bronx that I believe that they have maybe daily or even weekly runs that they do together. And they're doing a lot to shift the culture on what it means to get out there and be active. There's Bronx Health Reach, which is a an initiative from the Institutes of Family Health, and they're doing a lot of work as it relates to um, healthcare. There's so many other organizations out there that I feel like Most Healthy Bronx is going to partnership or that is
Mm.
going to partner with. Um, that strategy, we're still developing that right now, but stay tuned. 2021, that's going to be a very big year for us. We're only 6 months old right now, and
Mm.
we're still sort of getting our footing in terms of establishing our identity, um, as well as our main points of interest. So I can tell you that the way that we're structured is pretty much built on that county health rankings report that I mentioned earlier.
Yes.
We have 4 committees that are dedicated to health behaviors, clinical care, socioeconomic factors, and the physical environment. And we have a 9-person board, and there are about 3 to 4 people on each of these committees. Some people are on multiple committees. And right now, we are developing plans of action in each of these areas. So 2021 is when we fully expect to be on the ground and doing that necessary work within the community. But it's something we're definitely thinking about.
Well, thank you. I mean, because this is a holistic thing, and I think that's what on this show I've tried to talk about the whole person. You
Yes,
know, of the Bronx resident, of anyone, particularly us as a people. How do we feel better about ourselves financially, emotionally, spiritually, physically? Because we're not just about our house, we're not just about, our job. For those of us who still may have one, or those of us who may still have, we're everything. What we're about, if, like, for example, if I sleep better, I feel better. If I eat
hmm
better, I feel better. When I
absolutely.
exercise, I feel better. When I have some money in my pocket, when I'm able to pay my bills,
Yes,
when I'm not
yes.
always looking over my shoulder,
hmm
how I'm going to get the next meal, how I'm going to pay, I feel better. So you mentioned that, you alluded to that, the clinical part as well as everything else. And I applaud you for, taking this on. It's not easy, but it's necessary. And us in part,
Absolutely.
this is like us tying ourselves, with everybody else who's trying to do good, who's trying to make a difference. So tell
hmm
me about Most Healthy Bronx. My goodness. But what other initiatives going forward? What's your hopes? What's your plans? And what do your staff look like if you have one?
Yeah. So right now we don't have any employees per se. Everyone on our board has graciously volunteered their time,
Mm.
including our lawyer, who's doing the work with us as our secretary as well, doing this work
Okay.
pro bono. So shout out to you, Jared. You're the man. um, our team is pretty diverse. We have some health professionals. We've got a couple of current med students on our board. We've got, in addition to Jared, our lawyer, we have an additional lawyer
Mhm.
on our team as well, and people who are entrepreneurs and working in the arts. We're a pretty diverse group. Majority from the Bronx. We have 4 women on our board as well. So we're making sure everybody is equally represented. Equally represented, and every voice is heard in our community. Some plans that we have, I can tell you that I'm on the Health Behaviors Committee, and something that we're hoping to leverage is the Bronx Borough Presidents Not 62 hashtag, which is an initiative, a social media campaign that was started in, I want to say 2014, 2015-ish. So we're hoping to create a month-long challenge in which Bronx residents can participate in a sort of challenge for doing to sort of see who can do the most pro-health behaviors. So, for example, you'll be awarded 10 points for every time every mile that you run. 10 points for every 30 minutes of exercise that you do that isn't a running activity. So if you're doing like a yoga class or just doing weightlifting, you will lose points for things such as smoking tobacco products, drinking alcohol. And this isn't to sort of, say that we're anti this or anti that. It's everything in moderation, of course. I'm not a doctor, so don't listen to me. But we just want to have people thinking about their health more generally. I always like to think about in psychology. There's a theory that was brought about by Abraham Maslow called the hierarchy of needs. So at the very bottom of that pyramid is physiological needs. So that's like food, water, shelter. Actually, shelter might be above there. I wasn't a psych major, so don't quote me on it. And exercise is, for example, that should be a physiologic need. But people just out of circumstance, people who have childcare duties, people who have to tend to a home, cook meals, things of that nature, people who are in school, people who have to travel to and from work. A lot of these different lifestyle needs are sort of preventing people from really taking care of exercise, which is something that should be done almost every day. If you think back to, evolutionarily millennia ago when people were hunting and gathering for their food, now you can just walk into McDonald's and get a meal that's already been prepared. So the era that we live in has sort of minimized the need for exercise. So with this challenge, we're hoping to get people out there and get them active and thinking more about ways that they can be, active in the community. And, I feel like Bronx Soul, that would be a great organization to partner with on that effort. And, there will hopefully be a prize. So that's another incentive for people to participate in this as well. Not only are you improving your own health, but maybe you'll get rewarded out of it as well.
And how can people find out more about this Most Healthy Bronx? Is there a website they can go to? Social media platform they can go to?
Absolutely, yes. So we have a website that's called mosthealthybronx.org. You see that on your screen. We've got a Facebook page, a Twitter page, an Instagram page, and you can even connect with us on LinkedIn. Right now, like I said, we don't have any employees, but we're happy if people are willing to volunteer with us. Actually, this past summer we had 2 interns. It's crazy how that even happened. So I'm part of this network of it's a program called Prep for Prep, and they allowed me to advance my education. And they offer this internship program. And so I reached out to them. I said, hey, I just founded this nonprofit. Do you guys have any interns who are willing to, maybe work with us as we try to build? And we had 2 interns, and they helped us create some of our social media content. We have like a Google sheet of statistics, just compiling every major statistic about Bronx health. So those interns were great, but now we're looking to actually get on the ground and do a lot of this work. So, we're hoping next year around this time to offer, for Thanksgiving, meal deliveries. We're hoping to have a toy drive and a canned food drive. The holidays are really a time of year where people's situations get exposed and put on the forefront. Families who may want to provide certain things are not able to due to their financial situation. And with COVID, things are even worse right now. So unfortunately, we don't have the resources to do that, to be of assistance right now, but we're hoping to next year definitely make an impact there.
And I wish you all the best. As you said, you're on the ground level, and this is a pandemic. And as some of us, this is the pandemic within the pandemic being exposed even more.
Yes.
So
absolutely.
you're in the right place, seems, Maurice, at the right time. Because your services are needed. Seems to me we need to be reminded of how beautiful a people we are and could be even more.
Absolutely. Absolutely.
So as we start to wrap up Mental Health in You, I want to thank you again for being a part, for coming on and just talking about Most Healthy Bronx. What's its mission? What's its mission? Because we want to take the least out of it, because we're not least. There's nothing about it. But that starts with the mind. So if you can start with the mind and the soul, I'm not least anything. I'm most. I'm just enough. And where Most Healthy Bronx comes from. And that's what we try to do on Mental Health in You. I want to, we got to continue this conversation. So I want to invite you back real soon. I want to keep in touch, so let you see what you're doing. But until then, Maurice, thank you so much. We got to wrap up, y'all. But
thank you so much for having me. I appreciate you guys.
Well, thank you so much. Thank you so much. Until next time, from one Bronxite to another, peace and blessings. Take care. God bless.